Bismillah Rahman Rahim. Assalamu alaikum. Welcome back. 8:53 a.m. and we cross over to KZN. We're talking with Sumaya Hassen. She is the operations manager for Care for Cancer Foundation weekly feeding program at Addington Oncology Unit. Assalamu alaikum to you, Sumaya. Welcome to the program.
Walaikum salam. Jazakallah for having me.
Lovely to have you. And I was just telling my producer Nasreen when I saw her, when I saw that I'm going to be talking with you, when I saw your name on my script, I said to her, Alhamdulillah, because the area I live in Johannesburg, we have the most amazing women who are very, very active. And one group, from this very huge group of women who do all sorts of different projects, are involved in a similar program at the Helen Joseph Hospital. And they oftentimes also put out a call for assistance in making sandwiches and, donating to the sandwich fillings, bread,
Hmm.
juices, etc., etc., etc. And that just made me realize that, alhamdulillah, these sort of operations are running throughout the country at all state hospitals. So tell us, Sumaya, when and how did you become involved? How long is this running for?
Okay. Jazakallah. Yes, Care for Cancer Foundation has been at the forefront of assisting cancer patients from 2016, alhamdulillah. And we took upon this initiative of a feeding scheme at the hospitals. We actually started earlier. Well, it was supposed to be initiated in 2020, at the beginning of the year, and then COVID hit, and we were restricted from actually getting into the hospitals after that. And then, alhamdulillah, once all the restrictions were lifted this year, we implemented the whole feeding scheme again, where we go into the hospitals, to the oncology departments, the pharmacy departments. We distribute sandwiches, fruits, waters, and alhamdulillah, we get to meet a lot of patients. We try and go as early as possible because obviously people are waiting. We know that people are there from like 5 in the morning, and some people come from far out just to get treatment for the day, and they don't even have the basic, you know, um, necessities to carry a meal for the day, or to buy anything while they're sitting there and they're waiting. And they really are appreciative, and they're really happy to receive their meal packs. And alhamdulillah, it makes us feel good as well to be able to assist and to feed and to give out a simple thing like a bottle of water, a fruit. Sometimes will be, inshallah, we're going to get more sponsors for like yogurt and muffins as well, especially for the oncology department,
Mhm.
because that's where, we try and keep it on a healthier side of things because of the patients that are receiving chemo and things like that. So yes,
So,
alhamdulillah.
Sumaya, gee, I see that is it a once a week initiative? I'm
It's a
wondering if you're
once
not
a week.
thinking, yeah, I'm wondering if you're not thinking about possibly a daily initiative. I know it's huge, but the need is there. Here
No, alhamdulillah.
you're targeting the oncology department, but I should imagine it, every day the different patients that come for different types of treatment are in need
Definitely.
of
Yes.
of something similar.
Yes, that is true. But alhamdulillah, there are other organizations that are at the hospital as well. So currently, we have have been given permission to enter the hospital on a Tuesday. There are still a bit of restrictions because um, they're still obviously, you must remember the oncology patients are at a higher risk of picking up infections and things like that. So they don't allow more than one. Your food needs to be tested actually before it actually gets given out.
Sure.
So it's a long process. Yeah, they really
Sorry,
particularly
explain that
and
process to us. When you say the food needs to be tested, what sort of a testing
well,
does it undergo?
they make sure that everything is pre-packed. Um, they make sure that it's like nothing is contaminated. It's all sealed properly. Everything is handled with gloves. Everybody's using gloves when making the food. You have to write up a whole thing of where you're getting your food from, where you're buying your meat from, and all that there, and give it to the PR to make sure that everything is in order before giving it out. So I think they take it like for each organization that does whatever they do for the patient. So they keep that on record. Now, if you're going in every week and you're doing that, you have to make sure that your PR or the PR is informed of what you're distributing and uh, who's handled the food and if they've been tested, if they wore gloves, if they have their vaccination done. It's like, I don't know, that's just their precautions now. But maybe inshallah, as it goes, and everything eases up a bit more in the hospitals, it'll be better because you still have to wear, your mask. You still have to be, um, when you're in contact with anybody in the hospital, you have to make sure you have that social distancing uh, like that.
And rightly so, Sumaya, because it's not only for the protection of the patients, it's for your own protection as well. So, alhamdulillah for that. I'm
Definitely.
glad to hear
Yeah.
that that those precautions are still in place. Just to go back a step, you saying that your organization has been allocated the Tuesday Oncology Day, but you've also
Yes.
suggested that there are other organizations working there as well. So undoubtedly, you
Well,
guys, can I just finish what I'm
I'm not.
saying? You guys do collaborate with each other so that you don't have repetition. And alhamdulillah, the food gets stretched over possibly an entire week.
Yes. No. I know that we have the oncology on a Tuesday. There were other organizations that I've seen in the hospital, like being in the hospital for other purposes, distributing like alimdad and things like that, distributing water and fruits and things like that. I'm not sure if they also do the oncology department, but we mainly focus on the oncology department. So I really can't say, further than that about what else they do and,
Mm,
us
mm.
collaborating with them. No, no, we don't
Yeah.
collaborate with them. We're an entity on our own. We do assist. We get um, assistance and donations from the public to do our feeding. And alhamdulillah, it's been a great success. This week that I put out our request for assistance, and a lot of people have come forward with sponsoring, water and fruits and bread and our eggs and nails. So yes, alhamdulillah, it's been, a success in that. And we look forward to, inshallah, actually doing it in King Edward um, in the coming months. You know, we've put out a request to King Edward to actually go to the oncology department there, and we were just waiting for a response. So, inshallah,
Alhamdulillah,
possibly anything
alhamdulillah
that
for
could be
that.
King Edward. Yes.
Okay, I need to rush you now. I'm so sorry for that, but we need to take the 9 o'clock news very quickly. How do people get in touch with you to make their very meaningful donations?
Oh, yeah. Okay. Alhamdulillah. They can contact us on our landline, which is 031
Hmm.
836 8302, or they can contact me directly, which I would prefer because, I can actually handle the call myself. My number is 083 786 7011.
Do you have a web page?
And, and they can WhatsApp me on that number. Yes, it's admin. I'm sorry, that's my email. It's www.careforcancer.org.za.
Okay, brilliant. That's easiest. Thank you indeed. May Allah subhanahu wa ta'ala reward you and the rest of the group for all of your efforts. May you grow from strength to strength. Salam alaikum to
Um,
you, Sumaya Hassen, Operations Manager for Care for Cancer Foundation based in KZN.